Thank you, everyone, for the attendance. So, as been said, I'm going to present the research which we are doing on jurisdictional differences in training and authorization for prescribers who are focused on opioid dependence treatment. So, I'm going to present today the reviews that we have done from publicly available product or resources. So, I would like also to acknowledge the team members and as well as Tariq, who have been in this project from the start, from the idea, and also this project is funded by the Commonwealth. So as you all know, opioid dependence treatment is a big problem in our country, and it has been shown that treatment using those medications related for this one, like methadone and buprenorphine, they reduce opioid-related harm and mortality. And in Australia, what we found is that the prescribers' training and authorization process is governed by state and territory policies. But we haven't found any consistent research that will assess the consistency nationally. So this project is aimed on mapping the Australian ODT treatment, prescribers' training and authorization requirements, which will also be helpful for workforce implications. Yeah. So what we did in this research is we just reviewed desktop kind of review, that is publicly available products or resources, which include legislations, policies, guidelines, as well as online resources. And what we did with this one is we also framed those reviews into frameworks that we can assess eligibility, curriculum, refresher requirements, assessments, clinical placement if they need any incentives or they get any incentives, as well as the patient cap. Oh, sorry. So with the eligibility requirement, what is required for all ODT prescribers is they need to have APRA registration, and also they need to obey or operate under the state and territory control medicine guidelines. And with the processes, like with curriculum, the majority of them have similar outlines, like they focus on opioid dependence management and assessment, the methadone and buprenorphine pharmacology, induction and also stabilization process, as well as overdose prevention, diversion management, and as well as regulatory obligations. But other states, in addition to this curriculum, they have more extensive details, like Queensland, Victoria, and New South Wales. They added more on comorbidity management, special patient treatment, as well as long-acting buprenorphine treatment as well. But the other states like WA, Northern Territory, and Tasmania, mostly the curriculums are embedded in the regulatory practices or the documents rather than having a standalone by their own content. So with delivery mode and renewal requirements, delivery mode mostly in SA, Victoria, Queensland, and New South Wales, they have blended form of delivery, face-to-face and online. But the other states like Tasmania and WA, the documents mention that they support it, but there is not much detail in the online resources that we accessed. And ACT in Northern Territory, we couldn't find any products or resources that will tell us how they deliver the training. And the duration, as you can see, it's really varied throughout the states, from 3 hours online in Queensland to 11.5 hours in Victoria. But some states, they didn't mention any in the online resources, so we couldn't put any number into it. And regarding refresher and renewal process, it ranges from 1 year. They have to renew their license or authorization process every year to 5 years in ACT and 1 year in Tasmania. But the other states like SA, Victoria, Queensland, and New South Wales, mostly they said it's like periodic review with no specific date when they do the renewal or they require refreshers. So with assessments, in SA, what they do is they will assess at the end of the course, and they also have practical placements. But with Victoria and Queensland, they have online module, case learning, and they also have supervised practice. With New South Wales, Tasmania, they do exam and supervised assessment as well. But with ACT, they all focus mostly on the practical placement. WA and Northern Territory, it's mostly relied on regulatory compliance instead of having a specific assessment. With the patient cap, we divided it into two. There are states that allow prescribing ODT without taking the training for the treatment. So like SA, Victoria, and New South Wales, as well as ACT, they allow limited number of patients to be prescribed without going through the training from 5 to 30 patients. But other states, they don't allow prescribing ODT without going through the process of training. With the placement, like I tried to mention a bit earlier, some of them go through placements, practical placements, like SA and Tasmania, they recommended placement and mentoring for new prescribers. But the other states like New South Wales, ACT, and Queensland, it's mandatory to have a placement, especially for the higher prescribers, high-level prescribers or prescribers who have full accreditation. And Victoria, it's just presented as an optional kind of placement, especially for those advanced prescribers, which is also paid. Northern Territory and the WA, we couldn't find any related with the subject. With incentive-wise, most of states haven't had any documents that we can take out the information. But with SA, it's known that the DASA, through the GP program, they provide free training for the ODT prescribing training. But the Victoria and New South Wales, they have the strongest kind of promotion regarding the processes, like taking the training, CPD, and scholarships. They provide it for free for those who are willing to go through the process and be a prescriber. So in conclusion, from this desktop review, what we found is there is market jurisdictional variabilities as exist throughout the nation. And this variability could have contributed to inequitable workforce distribution and inconsistent treatment access. So this will give us or gives us more opportunity for coming together and discussing the next step on the training requirements and standardizing it nationally so that we'll have more workforce capability and as well as that will support equitable ODT provision. So with this study, the main limitation we had is we only did the desktop review, which is in process or in practice, they might be doing more than what we presented, but we only presented what we got online. So the next step to reduce this gap, we have a project that's coming. We have applied for an ethics application, which will be, we are going to talk or have a meeting discussion with experts like prescribers, regulatory bodies, as well as training providers, so that we will confirm the information we collected with them, whether it's correct or do we need any more information with the updated guidelines they have, because most of them, the documents are old versions that we found. So we will reconfirm the information we collected with speaking to the stakeholders. And the next step of our plan is to have a Delphi consensus or a study that we will have with experts to come to an agreement to have a national kind of standardized training and authorization for prescribers nationally. So that's all. Thank you so much.